Dr. Poddar, what is hypnotherapy?
Hypnotherapy is the process of hypnotizing someone and using it for clinical or therapeutic purposes. The whole idea of hypnotherapy is hypnosis plus therapy. Of course, hypnosis, as you well know, has been around for many years and many decades. It's been used by all kinds of psychiatrists and counselors and has become popular lately in an independent field called clinical hypnotherapy, and that's what I'm certified as a doctor in. I'm a clinical hypnotherapist.
Now, Dr. Poddar, many people believe that they can't be hypnotized. Is this true?
Almost everybody can get hypnotized. I mean, there isn't a person who cannot. A lot of people come to test whether they can, and that in itself is a barrier to hypnosis because they tend to fight it so much. And the whole idea is to completely let go. And once you let go, the therapy takes place much faster. So in terms of a person who comes in and says, I can't get hypnotized, we generally get them to hypnotize themselves. So I do a self-hypnosis technique on them.
So what's the process of hypnosis? What do you have to actually do to get a person in that state?
It's almost like a deep relaxation, pretty similar to Yoga Nidra, and the whole idea being that once the whole body is completely relaxed and you are not in control of your body, you allow your body to just be, then we can focus on the conscious and subconscious mind.
So people under hypnosis are totally aware?
You're completely aware in hypnosis. You're completely aware of your surroundings. You can, in fact, it's a heightened state of awareness. So you can actually even hear the sound of a pin drop. So it's very, very alert. Plus, your subconscious mind is also activated.
And this feeling of giving away information that you don't want to, that's a complete myth.
Yes. Giving away information is a complete myth. There's no way that I am going to be getting access to the part of your memory that you don't allow me to get access to. I can only retrieve information that you want retrieved, whether it be, and most of that information is from your subconscious mind. So your subconscious mind will help me get to the root of problem without any sort of hurdle that your conscious mind may pose.
And what are the clinical uses for hypnotherapy?
There are many clinical uses for hypnotherapy. It's used in long-term illnesses. It's even used in combating people who have illnesses, in helping them cope. It's used in combating any sort of ailment that is caused primarily in your mind. So once the disease in the mind sets in, it transforms into a disease in the body. So most often, if you have a disease in the body, like skin conditions that have been going on for many years, skin conditions are rooted in hypnotherapy in a past life or even in this life. And it takes us, we can go back to the root of problem and eliminate it. We use hypnotherapy a lot for anesthetic purposes. There's a lot of information that we have that helps us understand the different mental uses as well of clinical hypnotherapy.
Dr. Poddar, can you elaborate a little bit more? What about mental illnesses like bipolarity and manic depression? How would you treat those?
Yes, there are a lot of people who go to a psychiatrist get labeled as schizophrenics or bipolar or just manic depressants or depressants. When they come to me, we do not at all label them. We hypnotize them, of course, and we start talking to the subconscious mind to figure out what the problems really are. And your subconscious mind doesn't have all this terminology that your conscious mind keeps. So when the subconscious mind starts to talk to us, we actually understand what the problem is, and we can eliminate the problem as well from that space, because a lot of times it's related to a past life issue, or it's related to a age regression, like I might have to just regress you in age to get rid of the disjoint that happened in your personalities and then sort of lead you forward from there. So hypnosis works, or hypnotherapy rather, works really well with mental health issues.
And what about more mental health issues that take a more physical form, like Asperger's and other such illnesses? Can you treat those as well?
Well, a lot of what we do actually is focused on being able to treat almost all ailments. And yes, once we hypnotize someone and we get them aware, we can actually give them triggers so that they understand when the physical form is going to start, and they can sort of eliminate it before it starts. They can put a stop to it and sort of take control again.
So, Dr. Poddar, you believe that hypnotherapy can cure even chemical imbalances in
Yes.
the brain?
Definitely. We can even, there are different techniques, of course, but one of the things that we do is to give triggers. And we can give you a trigger that actually creates that that chemical that was imbalanced. It actually can create a surge of the chemical that you need to balance out the imbalance at that point. So the moment you kind of feel like you're going to be dipping, we give you a trigger. You press it, and automatically that imbalance that was there is not there anymore.
And what about work-related uses of hypnotherapy?
I use a lot of hypnotherapy in the workplace, and I especially find this very, very helpful. In fact, I've taken it a step further and created a technique based on using hypnotherapy, counseling, and all the different sort of management consulting techniques that I know. But hypnosis is used a lot or should be as well, used a lot in organizations for stress management. Stress management works like in about half an hour, all the stress is eliminated, and therefore the person sort of moves on and can continue their daily work without any kind of barrier or encumbrance. Now, we also use it for conflict resolutions, we use it for time management, we use it a lot for just the human growth chart. So if you actually feel that you're constantly hitting barriers at your workplace, so you work a certain level, but yet you get, a barrier comes into place. So we actually help eliminate those barriers, which may be barriers that you feel other people are placing on you, but the idea is that internally we feel a certain way about those barriers. So we help you cope with those barriers that much better and eliminate those barriers thereof.
So how does it differ from the personal use of hypnotherapy?
Well, the personal uses of hypnotherapy are actually quite similar, and they do overlap in a lot of different ways, because, at the end of the day, I'm dealing with the person. But in personal uses, there are other things such as relationship management and conflict management in the relationships, of course. And we also have in the personal uses things like weight control, weight loss. Weight, of course, is a very emotional issue for most men and women, and a lot of the times we gain weight due to protecting ourselves from a particular issue, etc. There are many different uses for it, even in terms of drug usage. So we can actually stop people from smoking, we can have them get more aware and actually put us to end to alcoholism as well. So it's used a lot in addictions. It's used a lot in nervousness and tic disorders. It's used a lot in fears and phobias as well. So basically, most of our problems, the base of hypnotherapy is that most of our problems start off in our mind and our subconscious level. So once we get there, we can start to eliminate all those barriers to help you live a more harmonious life.
And in pediatrics with children?
Yes, pediatric uses are very, very important and very effective. Unfortunately, in India, we don't use it as often or as much. But in pediatric uses, we have things like, children get very, very anxious about examinations, and they get very anxious about sports. We have sports enhancement, which we can actually use for adults as well. And we have, of course, exam fear or phobia that we have. We can eliminate that by giving them triggers. It's very simple with children to give triggers and to have them implemented, because they kind of find it like a fun thing to do. So they use it much more often. So therefore, once they start using it, it just goes deeper and deeper and becomes much more heightened in its results. We also use it for, say, sleep neurosis, or people having discomfort in associating or communicating at a young age. We can actually target the problem much earlier and eliminate it, rather than have them become adults and then not be functioning in society in the right way. So if you at any point find that there is something that you feel is amiss in your child, please bring him in. Of course, there are children that I can't communicate with if they don't speak English, or they're not ready to be settled. So I don't take children less than 4.5. But in case you feel that you have a child that is in need of this, I can teach the mother, or you as a parent, I can teach you the techniques that you should be able to use on your child when the child is in a relaxed state.
I've noticed more and more parents, they fear their children having mental disorders, especially ADD. So, in a case of a child actually having ADD, how would you deal with him? I mean, with a child who basically is not paying attention to,
Yeah.
or is paying attention but looks like he's not.
Well, the basic rule of thumb in hypnotherapy is that we don't label. So if the child has ADD and somebody's told me the child has ADD and they've diagnosed him as something, I actually don't even take the diagnosis. I have a set notion of what the diagnosis is, but I don't implement that in my treatment of the child. But when I'm talking to the child, I talk to, again, because I'm talking to the subconscious mind, we don't actually know. The child doesn't actually know that they have a problem. They're functioning at that level. And on a spiritual level, or in sort of that, just like work, what happens is that we don't think that children have ADD, but we try to figure out, what has been happening, how have they been coping, what happens, when do they lose interest, when do they start doing different things, etc., etc. So we actually focus on the child's behavior and eliminate that behavior from in the process.
But in such cases, many children don't pay attention to what you're saying. So how do you deal with them?
A lot of children are paying attention even when they seem like they're not paying attention. And that's actually, where our understanding comes into play. Most children actually learn while walking around, etc., etc. But society, because it's just easier for people to understand, for the teachers to control the classroom, they want them to be sitting still and doing it. But that is really not the most conducive environment for a child. But unfortunately, the child has to live in that environment. So then we start to label these children who are hyperactive as being abnormal, whereas actually they're normal, and there's only a different way that we can help them deal with these issues, and that we can do through hypnotherapy. But I would not think that the label would be something that I would put on the child, or start to think that they have a real mental problem, whereas they might not.
Okay, one last question, something that people are probably less familiar with. What's the difference between regression and past life regression?
Well, with regression, the person is who has an issue is not put into a hypnotic trance or hypnotic state. Whereas with past life regression, they're put into a hypnotic state, and then we kind of lead them to the different lives, or the different life that they need to see at that point. With regression, I don't need to do that. I go straight into the problem. I literally just dive into the problem, and we start working from that angle.
Okay, thank you very much, Dr. Poddar.
Thank you so much.